My name is Thilan Fernando, and I specialize in family medicine. I have doctors in my family, so I've been exposed to it from a very young age. But an important thing that I've always been taught is the importance of helping other people, contributing to your society, contributing to your community. So ultimately, I chose medicine because it was, for me, a career that gave me the most opportunity to do that. I went to medical school at Georgetown University, Washington, D.C., and then I moved back to Southern California for residency at Harbor UCLA Medical Center. Most of my family is in the Downey and Cerritos areas. So it's been really nice for me to be able to kind of come back to the community that I came from, that helped me get where I am and serve that same community. I've had the opportunity to establish care with patients that I've now been seeing for a long time. And so seeing them over time, being their doctor over time as they've gone through many different changes in their life, it's been gratifying to kind of just be able to have that continuity with the patient. Actually, when I was first training in medicine, my initial field of choice was pediatrics, because I liked working with children, and that's what I initially was gravitated towards. I ended up choosing family medicine because in family medicine, you still get the training to take care of pediatrics, kids, but you also get the training to take care of adults. I also kind of think of my job as a doctor as a teacher and educator. That's one of the things I try to do with my patients, is educate them about their health and their wellness. It empowers them to help themselves to do better for those conditions. It helps them to understand the importance, and then they're more likely to succeed in achieving that. I've always been taught that it's important to have a relationship with the patient and understand their background, where they're coming from, what decisions might be important to them. It's always important for me to have a discussion with the patient to make a shared decision about any kind of treatment or things that we're recommending for them. It's very important to understand, what the patient is feeling, their understanding of what's going on with them, and put yourself in their shoes. That's helped me a lot to really guide my therapies, guide my advice to patients based on their individual wishes and what they may be going through. For my mental health, I think family is a big part of that for me. I have 4 kids, all elementary school and high school age. So pretty busy with the family on my free time. We spend a lot of time kind of running around after the kids doing their soccer and baseball and basketball and swim and everything like that. We're also very involved in scouting. I'm a scout leader. All 4 of my children are in scouting. My family is originally from Sri Lanka, so we like to travel there sometimes. My wife's family is from Vietnam. We have not yet made a trip out there, but our plan is to do that pretty soon. What I like about PIH Health is if I need to refer a patient for specialty care or some type of test that they need, PIH Health gets them that. I would certainly say that PIH Health lives up to patients first.